Hello everyone. I know for each and every one of us nurses, nursing theory can be overwhelming. We all have the feeling, how is this nursing theory ever going to really help in day-to-day practice? Through this presentation, my main motto is to make you all have an interest in nursing theories. It's true that we all practice nursing, but mechanically. We are not technicians, but professionals. Professionals use the knowledge of the particular discipline, and for us, it is nursing. Now, with a few examples, I would like to show how we can incorporate the nursing theories in practice settings. Let's move on to the first animation. Here, the lady in the black dress is none other than Florence Nightingale. And the lady who is standing next as a nurse is none other than you. Here, you have to consider yourself as Nightingale, and you have to think about Nightingale's environmental model. If Nightingale was there to take care of the patient instead of you, what she would have done? Yes, of course, she might have manipulated the physical environment, which automatically will lead to the cure of the patient. The next picture will clearly tell what Nightingale had done. She took care of the environment. She cleaned everything. She provided adequate ventilation, lighting, removed that food items, and this cleaning. See the happy faces of the patient. This is how nursing theory of Nightingale need to be applied in the ward. See the bedding. See the environment. Everything has contributed to the health of the patient if you might have applied Nightingale's theory. Moving on. The next nurse who is sitting near to the bed is none other than Hildegard E. Peploe. If as a nurse you are there instead of Peploe, what you would have done? According to Peploe, interpersonal relationship is considered. By observation and communication, the nurse identifies the problems and resolves this. It will be up to you to choose the nursing theory or the theorist most in line with your beliefs and which is appropriate to your practice setting. Moving on to the next animation. Here, the patient has undergone a surgery, and after the surgery, the patient is not able to take care of all the self-care needs. Do you know that we can't be able to apply Nightingale's theory or Peploe's theory? A better theory which can be applied in that setting will be Orem's self-care deficit theory. And when we are considering that theory, and when you are standing at the level of Orem, so you will be thinking whether the patient needs a wholly compensated care, a partially compensated care, or simply supportive educational activities. This is how we will be thinking about application of nursing theories in practice. Whenever we are applying in this way, we can provide better patient care. Nowadays, nursing is moving away from care to cure. We are just following the orders of physician in curing the disease. But actually, as a nurse, we have to take care of the patient. The all aspects of the patient we need to consider. Moving on. See, if theory is one side and practice the nurse is doing in another side, then the nurse will not be able to do the care in a very proper way. We need to align theory and practice in the same way so that we can lead to a better patient care in a more beautiful and better way. Moving on, how to study a nursing theory. The first and foremost thing you need to know about the theorist. Why the theorist might have developed that particular theory. What was the educational background of the theorist? Discuss the development of the model. Through their education and practice, what led to the development of the model or theory? Then we need to describe the theory along with its concepts and how these concepts are interrelated in the theory. It will show the characteristics of the theory. Moving on, we need to state the meta-paradigms. According to Fawcett, there was just 4 meta-paradigms that were the nursing client or the patient, environment, health, and nursing. But later on, Abraham Malais, she told the meta-paradigms can be more, something more like nursing client, the transitions, interactions, nursing process, environment, nursing therapeutics, and health. Whichever way you like to describe the meta-paradigms, you can do in that way. Most of the older books of theories are stating only 4 meta-paradigms: the patient, environment, health, and nursing. How each theorist has considered all these 4 aspects in their theory. Then you need to elaborate about the nursing process using the particular theory. You know that the various steps in nursing process like assessment, diagnosis, planning, implementation, and evaluation are there. According to each theory, some might have fused together 1 or 2 steps and made the nursing process. So according to each theory, you need to elaborate the nursing process. Then comes critiquing the theory. Critiquing is mainly done in 6 steps. You need to tell about the purpose of the theory, whether it is met or not, whether it is clear, clarity is present or not for the theory. What about the simplicity? The 4th point is generality. whether in all areas we can apply the theory, whether it is for the adults or for the children or in the community, can we apply this theory? That's what is generality. Then comes accessibility, like in practice, how much is it used, whether the theory is used in research, so and so. Then comes the importance of the theory. So in these 6 ways, you need to critique the theory. Then enumerate the strengths and weakness of the particular model or theory. If there are studies, you can read and understand the studies which use that particular theory or model. Then describe if it is of some help in caring the patient. That is what is the nursing implications of the model. Last, explain your reflections on the theory, how it can be of help in the future for nursing care, or how do you feel about the theory. Happy learning and exploring theories. Thank you.